I'm going to try not to turn on my phone for audio purposes. And I'm going to see if they can. Okay, yay. I think we're good. It says we're live and they're commenting.
Very good.
Okay, good. And they can hear us. Okay, you guys, I am so excited to introduce you all to Dr. Cangas. He is actually our pediatrician who we were introduced to by another one of our amazing doctors who knew he would be a perfect fit for us. And of course, she was right. Not only is he very kind, but at our first appointment, he sat with us for over an hour just listening to every bit of our story and really getting to know us. And this was, the first time that we'd ever had someone who just truly listened and, didn't disregard our instincts and our research as parents. And, when we started talking about CBD and everything that we experienced with Maggie, as well as all of the research we had found, not only did he listen, you guys, he took it upon himself to really dig into it all. And he is just a great doctor who is open-minded and treats each patient as an individual, which we respect so much. So with that, welcome, Dr. Cangas. Can I hear you? There we go.
Am I on now?
Yes.
Very good. All right. I'd muted the cough and then I forgot to unmute, I guess.
No, yeah, that's good.
So that we, I think you hit the nail on the head there, kind of meeting people where they are. I've spent years being a pediatrician and kind of done like most docs do and just kind of had set my ways, and this is how you do things. And if you don't do them this way, you're not doing them the right way, kind of thing. And I've just kind of come to realize with my old age that, I'm not here to dictate care for anyone. I'm just kind of here to give my medical opinion, and smart enough to realize that my medical opinion can change based on information that I'm given. And I'm stuck in what I learned in medical school, trying to always evolve and be better at my job. And that's kind of where you guys came along at that perfect time in my career as well, just where I was wanting to learn more about some natural ways of treating kids and families. And you guys kind of opened the door for me to that.
That is awesome. Yes, exactly. Well, thank you so much. I have a couple of my personal questions that I would love explained. First of all, when I saw what it did for Maggie, CBD, I wanted to know everything, the what, the why was it helping her? Why was it so quick? And, what intrigued me so much was learning that we actually have an endocannabinoid system in our bodies. I had never heard that before. So can you explain the endocannabinoid system a little bit and what its function is?
I'll do my best. I'm still learning as everyone else is here. I'm a self-proclaimed CBD expert, which means I know more than probably 90% of the people know, but there's so much that I don't know. There's so much that we don't know that scientists don't know about CBD,
right.
Cannabinoid system. And you'll notice that I'll say cannabinoid, you'll say cannabinoid, and I might interchange those terms myself. They're the same word, just depends on where you're reading it and how it comes out sometimes. But take a step back. I didn't know what that was when you guys came to me either. And I'd had patients ask me for years about CBD, at least the last couple of years. And before the Farm Bill of 2018, where it became legal or more legal, at least, to get CBD, people were buying it from places that wasn't really legal to be getting it from. So I kind of stayed away from that and told them, you're on your own. And kind of like a lot of docs will say, even about CBD now, you never know what you're going to get in the bottle without regulation. So where to start? So I had to really just kind of buckle down. And I think I told you guys, give me a couple of months, because I have to read everything I can just to see if I can approve that you guys give a child CBD, because I didn't know what to think about that. And so, and the first thing I read about was the endocannabinoid system. And, I'd take a step back, research was really focused on THC and marijuana and how it affected the body. And in that research, they then found the endocannabinoid system, the receptors for which THC worked in the brain was kind of the biggest focus there because of the effects that it had. And then realizing that there were receptors all over the body Basically, almost every cell of the body has some form of a cannabinoid receptor in it. And those receptors then react differently on the cell and react differently in different people and in different circumstances. As a matter of fact, I mean, the general consensus is that the endocannabinoid system's role is to maintain homeostasis in the body and really just bring it back to a normal balance. So whichever way you are, whether you're too high strung, whether you're too low strung, whether you're kind of like temperature regulation, we stay at a steady spot, and our bodies are meant to do that. And that's how the endocannabinoid system works in our body, is to kind of keep us normal, basically speaking.
Yes. Yeah. And I mean, we knew it worked for sure, for her, for Maggie, for sure. So what symptoms can CBD help with?
Sorry about that. You froze for me there for just a second. What was the last part of that?
What symptoms can CBD help with?
Oh my goodness. There, in my practice, the things that I've seen reported the most and that I talk to families about the most are its use for anxiety, ADHD, inflammation being a big one. But there are, as you well know, there are lots of reports and studies showing its anti-convulsive, anti-seizure activities. I think the biggest things, like I said, that I really focus on are the anti-anxiety and the anti-inflammatory effects. So that affects so many different things about our body. I mean, inflammation affects, and that's the biggest one of the biggest parts of my practice is focused on inflammation and how nutrition affects our body and inflammation, and how supplements and hydration and sleep and CBD then again helps with inflammation. But there is a long list of neuroprotective, anti-cancer effects. There's appetite. There's what else? You can probably name off a few more myself. You put me on the spot there, and I had a list already in my head, and those are kind of the big ones, though. But again, you could probably, if you found out, if you have a problem and you looked on the internet, there's probably someone who says CBD will work for that. Whether it does or doesn't, that's another story.
Right.
And that's kind of where that journey kind of led me to. There's just so much information, misinformation. It's just really hard to know where to start with information for CBD on the internet.
Yeah, because there's just so much and you don't know what to trust. So that's why I'm so glad that you dug in, and because it is important. And I know that, even people just getting it from the gas stations, you don't know what you are taking exactly. So just research. And I mean, we were put in a spot to where we had to, and as I shared, before my post, we didn't immediately just give it to her because it's, we saw it on the internet. We really just started digging and looking into it, and, talking to more and more doctors and having them say yes, and so then when we met you, and that's, we had told you we had already put her on that, but, we're still wanting to know why, and is this okay? And, we trust you guys a lot. So we need that validation.
Thank you. You talk about how it works and why it works. I still haven't found good information on how it really helps with seizures. I don't know what you found in your time looking. I found a lot of information about how it works on serotonin receptors, and that would therefore explain a lot of its help in anxiety type symptoms. How it works on vanilloid receptors, which is how it's going to help with pain and inflammation. But I haven't really found a lot that tells me like how or why it helps seizures.
I think the biggest was just calming the brain waves. So as I say, like, it did not cure her seizure. That wasn't, she wasn't deficient in CBD in her body. That was what I found, was it had just calmed her brain waves. She had a lot more going on, as you know, but yeah, so it is amazing. Yeah,
that's one of the biggest things that happens. And that you say no CBD deficiency. I say that quite a bit in my practice, because I'll have people who know that I've spent a lot of time learning about CBD, and they'll make a CBD appointment, so to speak. And I'm like, well, that's not how this practice really works. I'm not here to push CBD on anyone. And I don't know if there, I'm sure there are people who truly need CBD to help in that journey. But especially, again, talking about ADHD and anxiety, I always focus on sleep and nutrition first and foremost. I've seen that change a kid's life. And CBD might be masking something we could easily fix with something else. But there are times when it does have its place and is a good fit or a good adjunct to get you by until you can make some of those changes and improve your lifestyle. And then with some of those chronic pain things, you've probably everyone's probably tried all those different things, and they might have some relief, but it's not solving all the problems. So adding something like CBD then can be a great help.
Yes. Okay, so what can you explain what's the difference between full spectrum hemp and a CBD isolate and marijuana?
Sure, and I'll go a little bit further because there's the middle ground that people are calling broad spectrum CBD products. And so let's start with an isolate, and that's the pharmaceutical version of the drug. Epidiolex is an isolate. It's the attempt to have only the CBD from the plant. So you've taken everything else out and left behind only the CBD. That being said, there are still traces of other things there, but minute amounts. So one of the isolates that I recently had tested, if you have tested with gas chromatography, can test down to 0.002% THC in an isolate. Telling you it's not THC free, but low enough that standard testing isn't going to find it. So when bottles do say THC free, I still kind of chuckle, which is one of the reasons that in the journey that I'm in is because I'm trying to just kind of clear up some of the things like that are out there. That there's no truth that's it, but it is the closest to THC free you're going to get, and there's basically none in there. Definitely not enough to cause any kind of euphoric highs, anything like that.
Yeah.
A full spectrum on the other end is really the attempt to leave all the terpenes, all the cannabinoids. There's they've found over 100 different cannabinoids in the plant at this point, and there's tons of terpenes, and those who know what terpenes are that work at the essential oil fields, know that there's a lot of benefits from that. So the combination of those all in one bottle left behind are thought to be synergistic, work together, and they'll call that the entourage effect. And then in between those two is the broad spectrum, where they've attempted. There you are. Oh, did I
cut out a little bit
there? Do you need me to go back at all, or is it
maybe just a second?
Okay, so I was talking about the entourage effect, I think, and then the fact that those work synergistically together to give you an improved benefit. There's a lot of work to be done to figure out how and why that is, but it has definitely been shown that a broad spectrum or a full spectrum will give better benefit than an isolate. But the isolate's definitely there for someone who wants to avoid the THC altogether. The broad spectrum then is in between those. It's really the attempt to take out only the THC from the plant and leave all the other things behind, giving you a 0.0% THC, but still giving you multiple cannabinoids and multiple terpenes left into that bottle. It's impossible to really just take out THC, so you do lose some of the other products in there. So that's in between. Another misnomer, again, I've seen many bottles lately and companies proclaiming they have a full spectrum that's THC free. That's really a broad spectrum. There are differences there in that bottle. And so I would again, it's all about being educated and knowing what you're getting when you buy a bottle. Companies don't have to be completely transparent. And sometimes the company doesn't even know they're not being transparent. They just don't have the education to have the knowledge to put that information out there, which is why I keep working to learn more and be as up to date as I can be.
Okay. You pause just for a second. Yes, it's okay, good. So dosing, that's always a huge question. So where to start for children and adults?
So I'll take a step back from where to start and tell you that you'll find all kinds of stuff on the internet about dosing. And I came across a Mayo Clinic dosing guide that was all over the internet. And I emailed all those websites, asked them where they got it, trying to find the source. Because if it was a source and it was a true source, I would love to use it and share it, but I wasn't about to share something like that. And finally contacted Mayo, and they were able to tell me that they obviously didn't make that dosing guide. So, I mean, that's just the nature of the internet. It looked like a great source, and it really looked valid, and I loved the idea. But then the more, and that was in my early stages, and the more I learn, I've realized after dealing with patients and seeing patients take it, that it really is person dependent. I mean, I know how many of you have taken other medications. Most of us have, and sometimes they work, sometimes they don't. For instance, I might give a child Adderall, and we do still use that once in a while, as little as possible. But I might give a child Adderall finally at a point, and the parent's like, "Oh my gosh, why didn't we do that sooner?" And I'll have another child that will have a full psychotic break, seeing things, hearing voices, and they're given the same amount. So again, just like that, our bodies are going to react differently. So my general recommendation, and again, I said recommendation. I can't recommend CBD since it's not FDA approved, especially as an MD. I can only just share experiences. But my experiences have been that a child, under 7 could start with 2 or 3 milligrams once or twice a day, and then every 2 or 3 days just increase that by like 1 or 2 milligrams. And so take some math. That's one of the joys of CBD bottling and dosing, and what's on the bottle is to figure out how much you're actually giving someone. Yeah. But it's possible once you've done the math, and there's always people that can help you with that, and I try to help my patients figure that out. So 2 or 3 milligrams, like I said, and increase every 2 or 3 days that by 1 or 2 milligrams, just to find what I call the sweet spot. There's definitely a bell-shaped curve to where you'll see improvement, and you take too much and you start to lose that improvement. So if you start too high, you definitely can miss out completely on the benefits of that. So I think sometimes we think more is better, and CBD is definitely not always one of those cases. There are people who need to take a lot more for certain pains and that, but as we were talking earlier, I have a friend, severe anxiety. She takes 5 milligrams in the morning, 10 milligrams at night of a broad spectrum. It's completely changed her life from someone who was throwing up before going to networking meetings, is how we met, and afraid to travel, to planning her bucket list trip to Ireland now because she's not afraid at all to travel. And her staff or employees, everyone has noticed, how much different she is because of that. So much so that some of them are now taking CBD as well because they, but because she had met me and because she trusted me and my knowledge that I had, she would never have considered CBD before, and it's changed her life. So again, that just goes to show you that, low dose can sometimes work very well for some people. And then, like I said, you just slowly increase till you find that sweet spot. And sometimes, don't stop when you get results. You might go a little higher and see if you get better results. And if you don't get better results or you get less results, then take that step back. There's a lot of, I've read a lot, and I haven't really ever seen it happen, but I've read a lot about how those receptors kind of get filled up after a while, and that sometimes it won't work as well after you've taken it. And some people then try to go up on the dose, but actually it's been shown if you go down on the dose, you can actually get some better improvement. Or maybe take a holiday, take a day or two off, and then kind of restart where you were and see how you do. So there's some different ways to kind of find that right dose. And adults,
my husband actually mentioned that.
Say adults, I usually say about 5 milligrams, and then again increase by probably 5 milligrams every 2 or 3 days to find that sweet spot. And again, that might be 5 milligrams, and I have people taking 100 milligrams twice a day. I don't know people taking more than that for the things that I talk to people about. There are people, I'm sure, taking more than that for a number of different reasons. And then pharmaceuticals, when they dose that, they dose it much higher than that even.
Yeah. Wow.
And that's when and that's when you start getting into some of the side effects. If you see on Facebook that, CBD causes liver damage, well, you're talking about 20 milligrams per kilogram that they were giving those patients that got that. So, a standard 60 kilogram person, a standard 60 kilogram person would be taking 1,200 milligrams a day. So, and that's when they got side effects and liver damage. So, we're not giving that to kids or adults. And for the things that we're
definitely not. And that's I wanted to say that it's a big reason why I wanted you on here too, is because I know so many people that are so hesitant, and I understand that because we were too. And so I do love, having just this knowledge out there that makes them feel more comfortable. Cause I was just very nervous to give that to my 6-year-old, but we were at what is the harm, as we were at our backs were against the wall, just let's just try it. We've been hearing so much good and not bad at all. So that's when we did it. And again, wish we would have known about it a long time ago, but it's great. So on the, are there any negative side effects then, would you say? Again, everyone's different. Obviously,
the most common side effects are sleepiness, which it's a side effect some people take the medication for,
right,
to help with sleep. Appetite suppression on higher doses for some people, and again, I've known people to take higher doses to suppress their appetite because they want to lose weight. And diarrhea. I don't know anyone taking it to get diarrhea, but other than those, the other two side effects are common.
Right. Those are benefits.
And so there, yes. Maybe if you're constipated, you could take some extra CBD for that. But but on that note, again, like you said, everyone's different. I've had some kids come back low doses and they're like, they couldn't stay awake all day. So we didn't stick with it for them. Those parents didn't really want to continue that. And I understood. I don't know. And I don't know if that would have gone away if they'd have taken it for a few days. And then if you're someone like me, I have tried up to 100 milligrams before bed. And that night, I literally looked at the clock every 5 minutes, and I was asleep. And I would wake up and I would look at the clock and feel like I'd been asleep for an hour. It had been like 5 minutes. And I was like, I am not taking CBD before bed again. I'd worked my way up thinking like it was going to help my sleep. But for me, it didn't. But I know so many people slept so much better, and not just slept better, but have a better quality of sleep, to where some people woken up after 4 or 6 hours and frustrated they couldn't go back to sleep. But then, after the conversation we had, like realizing they were wide awake, they felt refreshed, they didn't need their coffee, and they didn't feel the same way that they'd felt. They used to thinking they had to have that 8 or 9 hours of sleep, and they didn't actually really need it when they had good quality of sleep during that time.
Yes. So you so can you overdose on CBD?
I would say you could, but I mean, you'd be, especially if you have something like a 500 milligram bottle, you could drink the whole bottle and you might get diarrhea or sleepiness. You're not going to die overdose type of thing. So,
okay. That should make people, basically it's like finding, like you said, your sweet spot with your dose. Everyone's different. So, it's okay to try a full spectrum and an isolate and to find, what works best for you. You'll know how you are feeling. That's how you're basing your dose on, correct?
Right. Yeah. It's just whatever symptom it is you're trying it for, you just focus on that and how you see improvement or don't see improvement. And I would say don't give up. That's the hardest part, I think, is if you start at 5 milligrams and your dose is 50, if you're only going up 5 milligrams every 2 or 3 days, that's going to take a few weeks to get there. And some people after a week or two are just going to give up and say like, well, this doesn't work, but it doesn't mean it doesn't work. It's just sometimes a little harder to find and titrate up to get to that dose. So it's really just being patient with it as well.
Okay, awesome.
And I think when you're talking chronic pains, like, the first time I tried CBD, I was like, this didn't help my pain, but I'd had the pain for 10 years. Why did I think one dose was going to make my pain go away?
Right.
It did take repeated doses and decrease inflammation to help with my pain.
Yes. So can or should you take CBD while pregnant or nursing?
Oh, that's tough from the MD standpoint, because I clearly can't make any recommendations based on with no research.
Right, but they're bringing this to their doctor.
I will sometimes say that I would let my wife, if that makes a difference, and that's how comfortable I am with CBD. But there really aren't any true studies. I can't see where the downside would be. There's really not been seen, no studies that show any negative effects of CBD on people or even on kids. There aren't any true studies. So it isn't in my brain to think that there would be a downside to doing that. And I think it comes down to similar to like, what are you taking it for? Why do you want to take it during breastfeeding? Is it anxiety? And, a doctor's going to tell you if your anxiety or depression is bad enough, you should stay on your SSRIs. And are they really the best thing to be on when you're breastfeeding? Probably not, but it's better than being depressed, and it's not going to cause any long-term problems that we've seen. So I think that again, can't make a recommendation, but
right.
I would rather let my wife.
But good answer. Yes. Yes. Okay. Are there any specific medicines that should not be combined with CBD? And is there like a certain time frame to take the CBD if you're taking other prescriptions? So could you take them at the same time, or there's some to stay away from?
So first thing is, it does use the P450 system, which breaks down a lot of medications. It works on the same enzyme system, breaks down CBD, that breaks down those medications. So there are quite a few medications that I would say it interacts with the same enzyme system. So for instance, Coumadin is one that we know uses the same system. So if you're taking a certain amount of CBD and a certain amount of Coumadin, it could make your Coumadin levels rise. So it doesn't mean it's not safe to use together. It just means your doctor needs to follow your Coumadin levels so that you know where they are, and if you need to come down on it so you don't bleed to death from a paper cut, for instance. I mean, I don't think that's going to happen, but again, those are just, and again, this journey's been pretty entertaining at times and sometimes sad, but Facebook groups for some people selling CBD and some of those large groups where people will just ask, is it safe? I've seen the question, is it safe to take with Coumadin? And 20 or 30 people will just say yes. And that's the hard part about trying to get your information from people who, and you don't know where they got their training and what their information is. And some will just say that I do, but that still doesn't make it safe, because we do something doesn't make it safe. I think that little disclaimer comes from, it's not unsafe. It just needs to be with your doctor. Now, the hard part is going to be find a doctor who's comfortable with CBD enough to say, that they'll help you with that journey. So
exactly.
A lot of docs are just going to say you shouldn't take CD, and then they're going to be like you, trying to find a doc who work with you to get to the bottom of it. And not everyone's going to spend 2 months to take the time to read about CBD to let you know either. But this was just one of those times, right? I mean, you guys had a serious enough story. I've been asked about CBD enough. This was a big enough reason to say, I really need to, I just need to do this. So.
Yes. Well, thank you so much, because I mean, you've been wonderful with us.
Back to the medication, though, a pharmacist would be a good one to ask, because they can look up the drug Epidiolex and the drugs you're on and compare them. And that would tell you if they interact at least. So you'll know, like, you can at least know 100% if they don't interact. If they do interact, you might not know what direction to go with that. That'll take some work with the pharmacist and your doctor. But at least you'll know for sure whether they interact or don't interact at that point.
That is good to know. Good to know. So I know that you actually created 2 different lines of CBD. Can you explain them, and what was most important to you when you were formulating? And do you have advice on what to look for when choosing a brand, or things to avoid? I know we touched on it a little bit, but
first, I've got a website, CBD Expert MD, which is just CBD information, and that's the information I was gathering as I was trying to learn more about CBD, and I would find information that I felt was useful and I felt was reliable, and I just started collecting it in a notebook, and then I made that website from that. There are some buying tips in there, a good list of things to look for, some of those being looking for certificates of analysis. That's just your lab results to tell you how much CBD is in the bottle, whether there's any heavy metals, whether there's any pesticides, things like that in the bottle. So that's important to have, but also understand that people can just make a PDF that looks really fancy. That can be, so it really comes, trust is really hard in the industry because there is no regulation. Important for me was having a natural product. And that was probably the hardest step. Getting to flavors, when I was really just trying to find a product I could say 100%, I trust this for my patients, I trust it for my family. And so I spent a couple of months with that journey as well, just trying to find a company I could hang my hat on. And there was always something. Either they wouldn't give me the lab results that I wanted, was probably the biggest one. But then there are companies doing great things, putting artificial sweeteners in their CBD. And I'm telling people to eat clean. I'm not going to recommend a product that has artificial sweeteners in it. So I wanted that. And I wanted a company that was known with experience for extracting the plant, a company with experience for making the products. And so that was some of the biggest things. Gummies, for instance, too, corn syrup, artificial sweeteners, artificial flavors, just things like that are just not things that I would recommend anyone taking. I don't love that there's sugar in them, but I'd much rather have them eating some cane sugar than some of those other ingredients like that. So,
right.
And then flavor was a big issue. Many companies will make their products with hemp seed oil, which is great. I mean, it's got nutritional value. There's good omegas in there, but the benefits of CBD don't come from the hemp seed. It's just the ability to say the entire bottle is made from the hemp plant, which is a nice marketing. It's good for marketing, and it's not a bad thing. But if you don't like the taste, you're not going to like the taste. If you don't like the smell of hemp and marijuana, you're not going to like the taste of a CBD made with hemp oil and hemp seed oil, because it just tastes like you're eating plants and dirt. And I always joke with some of the adults who say, "Oh, I'll never take that." I'm like, you've probably done worse things and eaten worse things or drank worse things in your life. You can take a little dropper full of this every day, but some people are just too stubborn and won't do that. So I did, like in my products, I used MC2 oil because it's almost flavorless. An isolate's almost flavorless. A broad has a little more hint of flavor, than a full is going to have a little more flavor as well. And then for adding flavors, I just took peppermint oil and added just a trace, just enough to kind of take that edge off without any sweetness and having to have anything artificial in there. So those kind of the biggest things for me, again, is that transparency, having your lab analysis on the website, ability to call or email someone and ask questions and get a response from them, because some of the companies don't like to reply to things like that. That's going to be important to build that trust when you're looking for a brand.
Definitely. Awesome. Okay. I have, let's see. Okay, so I have one more question. Okay, one of them was saying, I take a lot of Excedrin for headaches, and I also take ibuprofen for pain in my legs, sciatica, and hip pain due to an old injury as a child. Muscle relaxers make me like a zombie if I take one at night. Can CBD help relieve these issues? And what type of CBD for her scenario?
I'll start with type. think that, if I would always recommend a full spectrum for anyone who has no fear of having the trace amounts of THC. Again, they're going to be legal amounts of THC under the 0.3%, not going to cause a high, but the combination has really shown to work better for most things, especially something like a chronic pain. So I would recommend that generally across the board for anyone who's able to do that. Again, if you have to pass a drug test for a job, you're going to be a little more likely to not pass that test based on, with that trace that's in there, it's going to still show up positive on a test. So but yeah, and then definitely a lot of pain, a lot of fibromyalgia. I've heard number of reports. All the itises I've heard, especially topical, works a lot for those. And I think for a lot of the pain stuff, I generally recommend starting with a topical and an oral and just kind of hitting it from both sides to start until you get some good control, and then kind of backing off of one or the other, whichever you like to do the least, and see if you can continue to have some improvement and continue to have some pain relief there.
Yes. Okay. So if people wanted to find out more on, more info on your, well, you said cbdexpert.com, they can go there to find, answers to a lot of frequently asked questions and a lot of the stuff that we talked about today.
It's cbdexpertmd.com, just to be clear.
Okay.
CBD expert out there. That's a whole different.
And I will link it below so people can just click on it. And then, if they wanted more info on your brand, then do you have two different websites or?
The main website is ladexar.com, and that's Ladexar sounds like a pharmaceutical name, but it's really just my kids' names kind of chopped up and put together because I wanted to use their names, and it's the best way I could come to get all three of them into one without leaving somebody out. So I just made up a word and I put it on the bottle. And the other line is called Zoe CBD, which Zoe is my wife's name. So I kept it all in the family there. So
yeah, that's awesome.
Ladexar.com and zoecbd.life are the two main websites to get to the product.
Okay. Well, I will post those links below as well. I think that's all the questions that I have, unless you want to add something.
I'll just add that on the CBD Expert, any of the websites that I just gave out, if you email with any questions, I'm happy to answer. And it doesn't have to be about my products at all. I just really feel it's important to have the proper education when you're taking CBD to do it safely and do it the right way. I really feel like it can do so much good for so many people. And I hate to see people not do it out of fear, out of lack of knowledge, or do it inappropriately and take any risk associated. So I'm always happy to answer emails about anything.
Well, that is awesome. Well, thank you so very much for, taking the time out of your busy schedule. We have a wealth of knowledge here. So that's amazing. And I will link all of those below. So if they have any questions, then they can just reach out to you too.
That sounds great. I appreciate you so much for having me on and letting me be part of your guys' life and journey. It's been
thank you so much. We are blessed with you. Thank you very much.
My pleasure. Thank you.
We'll see ya.